Hello, my name is Dr. Rebecca Muwanse, and I will be joining the Mille Lacs Health System this fall. I'm super excited. Uh, a little bit about me. I'm Ugandan, grew up in Kenya, um, but and growing up in Kenya in the 90s, I really was around the HIV epidemic. And I saw how lack of access to preventative medicine and lack of management of chronic diseases and access to healthcare really crippled the economy. And so for me, medicine was more than just people living long, healthy lives, but it was making sure that a community had the chance to bring real economic stability. And so medicine was always something that I knew I was going to be a part of. And it made me make the bold step at the age of 18 to leave East Africa for the first time in my life. And I went to college at Wellesley College in Massachusetts, where I studied biological sciences. I was really interested in being on the forefront of new discovery, and so did research at Harvard University after medical school. But I just missed being with people. I'm a people person. I really love the relationships that I find present in medicine. And so I decided to go to medical school at St. George's University and then did my residency training in New Hampshire. In New Hampshire, I grew more confident than ever that I really loved rural medicine. I liked being able to really get to know my patients. I liked being able to do the breadth of necessary procedures that were first line that my patients needed, where they didn't have to wait months to see a specialist because I could be there for them. And so it was an easy decision when my husband and I were deciding where to move because we have family in Minnesota and we'd been coming to Minnesota for family holidays for years. And so it just made sense to come back to our America home. And so here we are in Minnesota and we're super excited. Something that is really important to me about medicine and the patient interaction that I bring into clinic is, of course, I love people. But I find that I can also learn a lot from other people. And my perspective is always widened with engaging with other people. And so to me, the most effective tool I've found to have in my clinic is for the patient and the doctor to be partners. The doctor may be an expert in medical knowledge and medical experience, but it is the patient who's a true expert on their experience. And so when we partner together, that's truly when the effects that we want to see as a team come into play. And it's really exciting for me to be able to have that continuity with rural medicine. Here at Mille Lacs Health System, at the hospital, I'll be able to work and see my patients when they're there and follow them in outpatient to make sure I lower their risk of ever going back to the hospital. And that to me is really, really exciting.